Welcome back to the show, Kentucky Senator Mr. Rand Paul. Senator Paul, thank you. So what do you think of the new plan? I know it's not detailed, but, you know, direct to consumers, price transparency, get rid of the middlemen. There's a lot of interesting things in there that I think you yourself have espoused down through the years. What do you think of the president's health care outline?
Well, you know, one of the best ideas that I've worked with President Trump on is this idea of association health plans. This would be the idea that if you're an individual employer, an accountant, doctor, lawyer, small business, and you're able to join a collective purchasing agency like Amazon or Costco or Sam's Club, this is an idea that actually would allow competition, wouldn't cost any government money, and the president has previously supported it. It wasn't in the plan that was released this week. I guess someone left it out, but he has supported it in the past, and I think would be a better idea than a lot of the subsidy ideas. I'm not really for government funding this. I'm for trying to get the competition to work to bring prices down. The other thing you can do to bring prices down, doesn't cost the government anything, is only 10% of people with insurance products that buy insurance are allowed to buy HSAs. I would make the law that anybody who wants an HSA can have it. So 100% of America would be eligible. And then I think through market forces, you'd drive prices down. But some of the plan that was released this week includes something called CSR subsidies. These are subsidies that were originally passed by President Obama. So this is an idea of President Obama's, and the court struck it down. The first Trump administration said we're not paying it and didn't defend it in court. And now the second Trump administration wants to pay these subsidies. So some of that confuses me, frankly. They also want to give money to people to put in their HSA, which would be great if the government had money, but the government has no money. The government's $38 trillion in debt. We're $2 trillion in debt just this year. We don't have any money to give people money. So what we should be doing is trying to institute market forces to bring insurance prices down, but we shouldn't be doing sort of Obamacare light kind of ideas. And some of what I saw in this plan, frankly, is Obamacare light.
Can you get rid of these middle-level people, these so-called benefit managers that seem to get paid on both sides, actually on three sides, government, insurance, and consumers? A lot of down through the. Why can't you just go direct to the consumer?
In 1996, the court settled a case with the independent pharmacies, and in that case, they dictated that the only way you can give discounts is by this complicated formula of moving market share. So the drug rebate system we have now is not from the marketplace, it's from a court. This court settled verdict now rules the whole place, and it's so complicated that the PBMs, the pharmacy benefit managers, actually do bring the price down because you wouldn't hire them. Like, let's say you had a business, you had 1,000 employees. Why would you hire a PBM if they don't work? So the PBMs actually do work to bring the prices down. Everybody's just mad, and Big Pharma's been running ads against the PBMs for 3 years now. So it's very, very confusing, but everybody's pointing fingers at each other. But ultimately, if you let people join Amazon, to let Amazon bid for your drug prices will go down. If you let people join Costco or Sam's Club to buy their insurance, prices will go down, and you don't need any government expense.
Right.
And then legalize HSAs, you'd fix the problem with no new government spending.
I mean, one last thing, how about just a menu of prices? You know, if you come up to New York, Senator, I'll buy a good meal at an Italian restaurant, and they'll have a menu, and they'll figure out what your appetizer is going to cost, what your entree is going to cost, and if you want a cannoli for dessert. Why can't we just have that in healthcare?
The interesting thing is you have a menu that's explicit everywhere that you pay cash. So if you want LASIK surgery, a nose job, or a boob job, they will tell you the price on the phone within the first 20 seconds. They put it on billboards. If you mandate, and they're going to do this, it won't work, but they're going to mandate that you put the prices out. The Medicare price is fixed. The Medicaid price is fixed. The insurance price is fixed. The only person that is uncertain about the price is the one in the individual market, which is 8% of the market, and making the price transparent doesn't help them. You have to let them join a buying co-op or a buying collective to bid prices down. But mandating transparency doesn't work if the prices are not fluctuating.
All right. Well, we'll see how this thing shakes out. There's going to be a lot of work to be done. Kentucky Senator Rand Paul.